So in this video I'm going to talk about the USB 797, which has to do with sterile compounding regulations. So this includes your ophthalmics inhalations, your IV medications, and even your hazardous drugs. Well, your hazardous drugs could be non-sterile, but so the International Standards Organization, ISO, sets the standards for air quality. The lower the count, the cleaner the air. So I'll go over some of these areas. For the PEC, that is 5. For the buffer area and the anti area, that's 7 when it is open for a negative pressure room. And when it opens to a positive pressure, the anti area is actually 8. So negative pressure is used for hazardous drugs. So that's a little bit of USB 800, but hazardous drugs, the anti area and the buffer area should be 7 because you're using that negative pressure room it opens up to. For non-hazardous drugs, the anti area can actually be class 8. So some notes about cleaning your PEC. Your primary area should be cleaned before each shift, after a batch is made, every 30 minutes, and whenever it needs it, like including a spill. And you clean this with IPA 70% sterile and sterile wipes, lint free. So this next part was in the FAQ, so it's definitely important. But you probably are going to have this question on the MPJE. The buffer area and the anti area should have at least 30 air changes per hour. ACPH is sometimes the abbreviation there. The secondary engineering control, the SEC, is another name for the anti-area and buffer area. So, and those can have different air classifications depending on hazardous drugs or not. Like I just talked about, make sure you know that. But anything made in the segregated compounding area, SCA, has a BUD under 12 hours. The SCA cannot be cannot be near unsealed windows, and it cannot be near doors that lead to high traffic flow. And high traffic flow, I think RX Prep gives like cafeteria. I didn't see any examples in the USB, but you kind of get the idea. Glove boxes, isolators, those also have an iOS class of 5, and those are sometimes used for sterile. Those are ones you put your hands in. Some notes about testing. So training for sterile compounding involves the gloved fingertip test, which takes about 3 samples for both hands, and you want that to come back with 0 bacteria, 0 contamination there. And that's done annually for your medium and low risk CSPs. If you have a high risk, the testing is done semi-annually. So how often you test for these things, and that's the same for Mediafil, was in the FAQ, so that has to be important as well. But your technique is tested with the Mediafil test, and if you are doing high risk medications, that's done semi-annually. No talking, of course, is allowed in the compounding area, and that's the same for eating, drinking, and even coughing. When cleaning these areas, you actually go from cleanest to dirtiest area, opposite of when you put on your clothes, which I'm about to talk about. But when you put on your clothes, you go from dirtiest to clean, shoes, face, gown, hands. The walls and ceilings, the storage shelves should be cleaned monthly. Counters, places where you work should be cleaned daily. Some label requirements. So labels must have the names and amounts of concentrations of ingredients, the total volume, the beyond use date, the route of administration, any storage requirements, and other information needed for it to be used. All chemotherapy must have the label that says chemotherapy disposed of properly, or something similar. And the label should also indicate if your product needs to be light protected, if it needs to be filtered through a 0.22, or if it needs to be refrigerated. Your high alert medications should also be labeled as such. So some monitoring. Temperature should be done daily. Air pressure should be done daily. Surface periodic periodically. Air sampling is every 6 months. The sterile compounding should have a quality assurance plan also. So this includes training and assessments, any environmental monitoring, equipment calibration and maintenance. All these processes must be documented and follow-up actions identified with assigned personnel for each item, including end dates for the completion. Some notes on recalls. You're bound to get a question on this. It could be easy points. So class 1 is the worst recall. Class 1, you want to tell people immediately so they can get it off the shelves, because that can cause death or severe consequences. Class 2 typically causes temporary or reversible consequences, and a class 3 recall is not likely to cause consequences. So class 1, high alert, get that out of there. Class 3, tell them, remove it, replace it, send it back. So some other notes here. As I talked about garbing, that's done in the ante room, and that those shoes, your head, including beard covers, any hand hygiene right here. You can put the gown on. You enter your buffer area. You can scrub your hands. You can apply gloves. You can sanitize those gloves. Now, if you're doing hazardous drug compounding, and this is bound to be a question, 2 shoe covers is needed and 2 chemo gloves are needed. And if you're cleaning hazardous spills, you should use eye shields. So typically everything needs to be disposed of. Your gown can be kept in the compounding area for sterile compounding. Your gown can be kept there and used again when you return. The hood can be left on, or it can be turned on 30 minutes before use. And in summary of these highlights, so the primary area is iOS 5, buffer area is 7, anti-area is 8, and anti-area for hazardous drugs is 7. For your beyond use dates, now this is set by 797 standards unless an ingredient in there expires sooner. So, and the 797 actually determines BUD by risk level. So I'm just going to try to group these together in an easy way. There are lots of charts out there, but low, medium, and high risk for hazardous drugs are for non-hazardous drugs. So first I'm going to go over non-hazardous drugs. Low, medium, and high in the freezer, 45 days. Low risk at room temperature, 48 hours. In the refrigerator, 14 days. Medium risk at room temperature, 30 hours. In the refrigerator, 9 days. And high risk, of course, is going to go even lower. High risk at room temperature, 24 hours. Or 1 day. And in the fridge, 3 days. So 14, 9, 3, 48, 30, 24. And if you make something for immediate use, it has a 1 hour beyond use date. Easy. You're not going to refrigerate, you're not going to freeze it. For hazardous drugs at room or fridge, pretty much, it's less than 12 hours is going to be your BUD for your hazardous drugs, regardless of the risk level. And another note is your single dose containers, also mention your FAQ. So if it's made outside iOS 5 air, you have 1 hour from puncture to use it. If it's made inside iOS 5 air, you have 6 hours from puncture. And everything's pretty much one use, even your ampoules. And for your multi-dose containers, though, you have 28 days from puncture, unless it expires sooner. So the next video, I'll go over USB 800, talking about pretty much what they say about hazardous drugs. Good luck.